Hey, friends and family, and anyone else listening. I give you permission to share this video if you'd like. I wanted to just make some information available that us in the medical community are well aware of, but that you may not be getting in from your news or media sites. I just keep getting the question from lots of people, which is totally understandable, of do we really need to be this cautious? Do we really need to put all these travel bans in place and socially or isolate socially so drastically? And I just kind of wanted to explain why. Because in my life in general, if I don't know why we're doing something, then I have a hard time getting on board. And I would love if you could get on board with what we're doing as a community. So if you don't know me, my name is Hannah. I'm an emergency room nurse and have been one for maybe 7 years. My husband is a family physician, and so we are both on the so-called front lines of this pandemic. And it's just starting to ramp up in our community, but just by the knowledge we have so far of the virus, we know that there will be more. So grace and peace to you. I pray that peace will surround you as I share this with you, and not anxiety or fear. People are dying of the coronavirus. We all know that. Old people are dying a lot more. We all also know that. But there are also a lot of young people out there who are getting sick, and some of them are getting really sick. And a big part of this movement is to protect our elderly, but it's also to protect ourselves and those around us who aren't elderly. And one of our main struggles with coronavirus as a medical system and the ability to control it is that the first 5 to 7 days of the illness are very mild and can be very mild, with minimal symptoms, possibly even no fever, mild cold symptoms or sore throat. Diarrhea and vomiting has just come out as a possible symptom from this, or actually the CDC hasn't released that one, but I've been reading some articles out of China, or not just articles, but legitimate medical studies that they've done during their outbreak, and they've published already for our help. So anyways, the beginning of the virus can be very mild, and that's all it might be for you. But during that time, you are contagious and spreading the virus. And the numbers currently are showing that for every one person that gets the virus, they will infect 2.2 others if they're not properly isolated, which means as soon as they, and maybe even before they start having symptoms, are not coming into contact with other people. So that's the beginning of the virus. And then the studies in China were showing that people don't seek medical attention. They don't feel like they're sick enough to actually seek medical attention for 6 days after the beginning of their symptoms start. And then they don't need hospitalization. One of the studies was saying from 7 days, and another one said 10, and then another one said 12. So there could be a long period of time that you are sick with the coronavirus and don't need to be hospitalized. And if you are not taking proper precautions during that time, or if you're around someone who is not taking proper precautions, the virus is being spread even more. So, So one of the main things with social distancing that I'm sure you've probably heard about is like lowering our curve and not overloading our medical system, which is what happened in Italy last week and is continuing to happen. So out of people that developed the pneumonia from the COVID-19, 25% from the China studies will need ICU ICU level care, which doesn't say in the study, but to me as a nurse, that means they need like respiratory support and probable like intubation, where we put a tube down your throat and we use a machine to breathe for you because your lungs are not functioning high enough to oxygenate your blood and keep you alive. So that's something that we can easily do. But if our population around us does not socially isolate and there's too many people that are sick and need respiratory support like that at the same time, then we will run out of the resources to oxygenate your blood, intubate you, keep you alive, keep you going, which is the reality of what was going on in Italy. From what I've read, there just wasn't enough resources, and that's what we're talking about when we're talking about resources. Nurses, physicians, and medical equipment needed to support your airway and support your lungs while they're not functioning well because of the pneumonia. Also, just talking to people. A lot of times when people get a pneumonia that we talk about just in general, it's a small area in your lung that gets infected. And the difference with COVID pneumonia is that your whole lung gets infected. It's diffuse, so it's all throughout, which puts you at risk for developing what we call ARDS, which is acute respiratory distress syndrome. And that means that oxygen can't get across your the membranes in your lungs and into your bloodstream. So hopefully this isn't too medically for you, but pretty much what I want to say is that social distancing is so important because you may have what you think is a very mild illness and you might be putting someone's life in danger around you. And you might not know that for a few weeks. You may never know that you put their life in danger. But if we overload our medical system and have the inability to have the resources we need to keep people going while their lungs aren't functioning well, then we lose a lot of people and they die quickly. If you need respiratory support and we have no more ventilators, then that's most likely the end of your life. That sounds really morbid, but it's serious, and it's why the government and our local agencies are taking this seriously and not messing around. So let's see. Some of the other things I wanted to talk about were, so right off the bat, the CDC, and I'm sure you've heard of the symptoms of shortness of breath, fever, cough, and it's from what I've read, it's a dry cough, and that those are like the symptoms of COVID-19. But reading the China studies and also just starting to see it in the U.S. ourselves, there are more symptoms, and the CDC updated their website in the last few days, from what I could tell, to include them. So, dry cough, shortness of breath, fever, obviously those are the ones you've known. Fatigue can be a symptom of infection with COVID. Body aches, like with the flu, headache, dizziness, abdominal pain, nausea, vomiting, and diarrhea, lack of appetite, and confusion. So there's really a whole lot of symptoms. So you may have a stomach ache for a few days, not think much of it, not think you need to stay home, or wash your hands any more frequently or anything like that. And you might actually have COVID. So I just wanted to encourage you to stay away from people, especially if you have anything in you that feels sick at all. Also wanted to encourage you that if you develop these signs and symptoms, don't freak out. It's very possible that you could have a mild infection and you could get over it at home just fine. If you start developing difficulty breathing, shortness of breath, chest pain, if someone around you gets confused, those are all reasons to seek medical attention. Unless you feel like you're actively dying, call your primary care doctor first. They're the ones that are supposed to screen you for testing. If they, or if you don't have a primary care doctor or they can't, you can call 211. That will get you to our Tulare County office, whatever it is, health department. And they can screen you on the phone. From what I've heard, that's what we've been getting in the emails and stuff. I'd always love to be available to answer questions, although it's just my advice and not anything. Just always love educating people, I guess, about health stuff. And so I've really been blessed by all of you out there who, all of you friends and family who have texted Stephen and I just to pray for us and to bless us as we ramp up here in the medical world to take care of all the people that are infected. We also just come home Stephen comes home from work every day, like distraught at the amount of people that are not social distancing, even that he sees on his way home from work. And I just feel like we're going to see the effects of that here in a few weeks. Another thing that I wanted to let you know, that the hand hygiene is so important. And it's not just if people are coughing, it's actually orally, fecally transmitted. So super important for us to have really good hand hygiene. We may have very mild symptoms or no symptoms at all, but if we're not using good hand hygiene in life, then we are going to spread it. And let's see, anything else I wanted to share with you guys? Back to like the use of our medical resources. It's like if we never get more patients that need to be intubated than we have ventilators, then we can take care of every patient that needs to be intubated. We can put them on a ventilator. But if we can't, then, or if we have too many patients that need to be intubated, and we don't have ventilators, then obviously we have to do some triage and stuff, which as a medical professional, that sucks. And obviously I wouldn't be doing that, but there would be people out there doing it, and they have been in other places. There's a lot of the studies from China showed that people who were younger still needed to be intubated because they still developed some amount of respiratory failure, but they didn't necessarily die from the respiratory failure. So the young people, even though they're not dying, they're still getting really sick, is what I could gather from what I was reading today. So I just wanted to kind of nix that whole idea out there that this is just to protect our elderly, that us young people aren't going to get sick or require hospitalization or ICU stays or intubation, because it's not true. At least it wasn't. It hasn't been in China. let's see. Not everyone who gets COVID will develop pneumonia, which I guess you could deduce after saying you just might get over it with a mild cold. Most people don't, I think I already said that, most people don't develop symptoms to warrant medical attention and for 5 to 6 days. If they need medical attention, it's usually not until then. So also just to be aware for yourself and your family that if you feel like you have a mild illness and then after almost a week of it, it starts getting more severe, then just to be on alert about that. One study said people didn't need hospital admission until the mean day of 12.5 from the beginning of their infection, which is a long time. People out in the community. Yeah, I think that's all I wanted to share with you guys, but it is serious, and we as a medical community need you as the public community to take it seriously, to not blow it off. It's not an issue of fear or getting hyped by the media. I haven't even been watching the news, but it's an issue of serious concern and pandemic. And do we care more about ourselves or the people in our community? Are we willing to make sacrifices for them, for people that you don't even know, that you might not even ever know that you affected their lives? So I hope you all choose to do the right thing in this time of uncertainty and just a different kind of life for the next few weeks here. So blessings on you. May you be protected from severe illness, and I hope this was helpful to some of you. Don't forget to pray for us, all us medical professionals. We appreciate it. Hope you guys are doing well. Bye.